I'm Dr. Chip Cole. I'm a quadruple board certified oculofacial plastic surgeon. And today we're going to talk about under eye bags. There's a lot of terminology that people get confused. And I think the main thing to think about is when we start aging, under the eyes, why do we age? And it's interesting because why is actually, you can see here, the shape of the anatomic changes, and it all has to do with ligaments. You need to think about aging always starts from the inside. That's why I do inside out surgery. So I want to explain to you what it's all about, what causes all these bags, and the terminology. So if you look at this slide, the Y represents the distribution of the ligaments. And when the ligaments change and water accumulates, then you get fluid changes. Those fluid changes I like to think of as almost like a balloon. So if you think about it, you've heard the term festoon. Think of it like a festering balloon. That's what I call a festoon. If you look under the lid and the lid cheek junction, the 1 and the 2, that forms the upper part of a Y. And the line going down, we'll call that the tail of the Y. That's the junction of the malar or cheek region to the nasolabial fold. So what happens as we all age or get wiser, I like to say, is the tissue moves down and in, and those ligaments cause the restrictions. And it's the fluid changes with the ligaments that give you the under eye bag. You can have bags in the eyelid alone, or you can have fluid in the cheek and the malar region, and that depends on how severe it is. Some people have bags and festoons, some people just have bags. But if you have festoons, you usually have the accompanying bags in the lower eyelid. So when we look at the ligaments, you can see that in this diagram, there's the orbital malar ligament. You can literally feel the bone of your orbit. That's where that ligament is. And below it is the next one, what we call the zygomatic cutaneous ligament. And then you can see the muscles below. As that tissue migrates down and in, you get that comma-shaped fluid. And it's interesting, if you look at somebody young, like say Kylie Jenner, that has fluid and changes in that area, the reason she has it is because her ligaments, with all the injections, is starting to get loose. And that's a common thing you see in young people that have had a good bit of filler. When I'm teaching physicians, I like to do a cross-section to show them conceptually what they're dealing with. If you look at this picture, you can see all the way down to the bone. That's where the ligament starts. And the ligament attaches through the various layers to the skin. So therefore, how could you do a laser only, or how could you do something to skin and think that you're going to improve the swelling, the edema, the bags, and the festoons? You're not going to. All of it starts from the inside at the bone level. The advantage of me with the training I have in ophthalmology and plastic surgery, I'm very comfortable going behind the eyelids, underneath the lip, and attaching and moving and changing this anatomy with no scars on the face. So let's talk about treatment. If you look at this slide, you can see you've got a comma of blue. That's what I call the balloon, the festering balloon or festoon. That fluid is just going to sit there in that layer if you don't release the ligament, recontour the tissue where you've got to tighten the muscle and the ligament, and then you reset it at a stronger, higher position. That could all be done from the inside. So in summary, if you look to the left, you see normal youthful anatomy, and you can see the balloon area is a potential space. There is no fluid there because the muscle's tight, and the yellow area is the fatty cushion that we all have. Think of it like an airbag around your eye. You're designed to have that volume and you want to keep it. But if you look to the right, you could see when that air balloon ruptures, so to speak, and it billows out and the muscle weakens, then things push out and that fluid bag will fill, and that's where you get either a puffy eye bag, or if it's more advanced, you see below it, you get changes and that makes a festoon, or what we also call a malar bag. The reason it's called a malar bag, it's in the malar region, which is the cheek. So in summary, you have to start from the inside. The inside out approach is the only way to correct festoons and bags from the inside without having a scar. So if you want to improve your lid, your bags, your festoons, your swelling, your cheek, all of it can be done with no scars with the inside out approach.